realize that it is difficult to do. I realize that people are tired, and I realize that it is actually hard to make these changes to our lives.
The city's top doctor calling for tighter measures on another record-breaking day for COVID-19 cases. Torontonians asked to only leave their homes for essential activities, with public health experts also putting a pause on social circles. Good evening. With the province of Ontario trying to clamp down on gathering sizes, the City of Toronto is going one step further.
The medical officer of health is asking for the power to implement changes in the hopes of avoiding full-scale lockdown measures. They include the suspension of indoor dining in restaurants and bars, the cancellation of fitness classes and sports activities that are held indoors, and a recommendation that people only leave home for essential activities such as work, school, and health appointments. Dr. Eileen DeVilla's comments come in the wake of new conditions introduced by her provincial counterpart.
Rules around testing and face coverings are being expanded, and everyone is being asked to stay within their household bubble. We'll get to those measures in a moment, but we begin with CTV's Scott Lightfoot, live outside Toronto City Hall tonight. Scott.
That's right. Dr. Eileen DeVilla says these are Toronto-specific measures that need to be quickly enacted in order to slow a rising spread of COVID cases in this city. She also says she believes they exceed the authority of her office, so she's asking the province to put them into place, and if not, to give her the authority to do so.
The picture is clear. Infections have risen dramatically and consistently.
The numbers have risen quickly in this city. Toronto Public Health says the 7-day moving average of COVID-19 cases went from 40 at the beginning of September to 84 by mid-September to 236 at the end of the month. That's a nearly six-fold jump.
These numbers won't reverse on their own. They won't reverse themselves.
According to TPH, there are now 169 active COVID outbreaks in Toronto. And over the last 3 weeks, outbreaks in long-term care homes have gone from 2 to 9. Near the end of the month, 44% of outbreaks were in restaurants, bars, and entertainment venues.
Quick action is needed now.
Today, Dr. Eileen DeVilla, Toronto's medical officer of health, released a letter she sent to her provincial counterpart. She's calling on the province to suspend indoor dining at Toronto's restaurants and bars, suspend indoor fitness classes at gyms and indoor activities for sports teams, and require large venues like banquet halls to provide a plan of how they will adhere to COVID protocols. She's also asking Torontonians not to leave their homes, except for essential trips like work, school, medical appointments, or to get food.
What I don't want is a return to a lockdown like we saw last spring. I do not believe that is necessary. My proposals are meant to prevent the conditions that would force a large-scale lockdown.
This is strong medicine, and I know that it will be bitter for the businesses directly impacted. But now the resurgence is here, and our doctor has issued a prescription that we must follow.
Dr. DeVilla says she's been given legal advice that making these changes would likely be out of the scope of her position. So she's asking the province to act, and act quickly.
If I had the power to do this, I would have done it. And it's just this simple, right? I'm asking the province to do it or to give me the power to do it. And if they give me that power, I will absolutely take the necessary measures to do what needs to be done to protect the health of this city.
And Ontario's Chief Medical Officer of Health and the Minister of Health both acknowledged this afternoon they had received Dr. DeVilla's letter. However, they did not say if or when those suggestions would be acted upon. Both Mayor Tory and Dr. DeVilla said these measures would be temporary. Dr. DeVilla suggesting they would be in place for a minimum of 4 weeks. That's 2 incubation periods for the virus. And at that point, they would be reassessed to see if it's safe to start rolling them back. Reporting live outside City Hall, I'm Scott Lightfoot. Nathan, back to you.